My name is Mahin Rehman. I'm a non-invasive cardiologist and cardio-oncologist here at Prisma Health. I grew up in the Northeast, and that's primarily where I went to school and trained in internal medicine, cardiology, and cardio-oncology. So being a cardiologist, I take care of heart health. But being a cardio-oncologist, that entails me to collaborate with the patient's oncologist to plan a very good path forward in terms of their oncology care, but also the patient's cardiac health during that oncology care. So whether it's assessing patients before they receive their chemotherapy or radiation treatment, and then ultimately before, during, and after as well. And this also includes patients who had cancer earlier on in life, like childhood, and now because of their treatment earlier on in life, there are some risks that pose to their heart that I would have to follow them up and, ensure that down the road that they're doing all right. What drew me to dive into the world of cardio-oncology is that, I have some personal experience with close ones who have had cancer, and because of the treatment that they had to undergo, it ended up having a negative side effect on their heart health. So that long-term exposure over the course of my life allowed me to kind of take more of an appreciative role into this new developing specialty within cardiology. So I collaborate with the patient's oncologist to come up with a good regimen and ensure optimal cardiac health during the patient's therapy treatment. But a lot of times it comes into just a planning phase too, and doing a cardiac risk assessment for these patients who haven't received therapy yet, but are planned to receive therapy. And then there's also situations where individuals may have had cancer earlier on in life, like childhood cancer, and that treatment earlier on in life now poses decades later a potential cardiac risk. So these are the kind of patients that I would be ultimately seeing and helping out and optimizing their cardiac health. I believe patients get very overwhelmed with the long-term health goals that doctors may be setting out for them. So in order to allow my patients to truly follow recommendations, I think the best approach would be to keep things on the simple side. So rather than taking a long-term health goal and be like, hey, let's achieve this by next year, change it up a little bit into more simpler terms, like, all right, how about this week we just go for an extra 30-minute walk a day? Doesn't even have to be uphill, it could be, on level ground. But breaking these larger goals into smaller, achievable, possible outcomes is ultimately going to have the biggest impact in the long run. And keeping things simple is what I believe will end up benefiting my patients when it comes to recommendations and instructions. I enjoy the outdoors and hiking and getting a lot of sun, and it was primarily one of the reasons what drew me to the South is to have more time outdoors, especially with my children. We'll be getting a dog later this year, and hopefully looking to do some more activities outdoors with the dog, and hiking and going to the beach, checking out the mountains on the west side of the state. If you have a general cardiology concern and you'd like to make an appointment, please call the number on the screen. If you have a cardio-oncology concern, please have your primary care doctor or your oncologist make a referral.